an amazing team, and I would encourage anyone who's using, the services of a palliative care team to push their family in and bring them to appointments. It was such an important part of the recovery process for all of us. I think when, especially a cancer diagnosis, the whole family isn't then diagnosed. This is happening to everyone in the family, not just the patient. And palliative care embraced our thinking of that this was something that we all needed to get through together.
Yeah. I think one of the most important things palliative care teams do is exactly what you're describing, which is good communication and coordinating care. And, I used to say I still say to my teams, my job often is the easiest part as a physician. I might have to write a prescription for a nausea medication or a pain medication, but the navigator or the social worker or the nurse or whoever it is on the team whose role and responsibility is to communicate with the family so that all their questions are answered, to coordinate care with all the other clinicians you have involved, like oncology and maybe dietitians and whoever, somebody who's really in the middle of all that and knows what's happening and can communicate with you and say, if you have a question, I'll call so-and-so over at your oncologist's office and get that answer. I mean, that brings everybody's, anxiety level way down because they know somebody cares and is quarterbacking.
And just having those people able to pick up the phone. I know my palliative care team got in touch with my oncologist and radiologist a lot quicker than we could.
Yeah.
And that's was so helpful throughout the entire experience. What would you tell someone who's watching this video, who kind of stumbles across it, who's needing palliative care in their life? How do they advocate for themselves to get it?
I think one of the things I try to convey to patients and families, and even my colleagues in the clinical side, is that palliative care is based on a patient who has serious illness, who has unmet needs. It's not based on prognosis. Whether you have a cancer you're going to get cured from or a cancer that you may live with for a while, it's irrelevant. If you're suffering, our role is to reduce that suffering. So when we talk to patients and families, I try to encourage them to say, this is what it's like for me at home. This isn't working. I understand that palliative care might be able to help to fill in some of those gaps, and I would like to do it. So not focusing on what the diagnosis is or the underlying treatment or any of that, making it about what matters to the patient and family. And when you take it out of the medical and make it about me or the person, I think you find a more receptive site for somebody to say, okay, I'll get you over to palliative care. Because we're trained, all physicians like me, and I'm guessing even nurse practitioners and PAs, we're trained to deal with illnesses, not to deal with people necessarily. So when you make it human and you bring in like, I'm suffering or this isn't working for me, it stops us and makes us think like, okay, maybe we need some help here. Who can help us? And palliative care sounds like a good idea. The other thing I would say is, I'm sure you're familiar with the getpalliativecare.org website. There is great downloadable tools to help patients and families talk to their clinicians or physicians about, wanting palliative care and some of the questions that they could ask. So on a very basic level, I think focusing on what your experience is living with the illness and an honest assessment of that. The one thing it took me a long time in my medical career to learn was that patients often put on their best face when they come to the physician. They don't necessarily want their physician to see what it might be like day to day for them. It's almost like they feel like they're failing or something if they don't make me feel like I'm doing a good job. And, if there's a way I can communicate with patients to say, just be honest about what it's like day to day, because there's help out there as you learn, right?
Right. I remember my doctor saying to me, you don't have to be okay. We know you're not okay. And I think as a patient, you're so dependent on everybody that you kind of, I can speak for myself, I just didn't want to be so needy, but I needed to be needy. And I remember my doctor saying, it's okay. It's okay to be where you are. You are exactly where you're supposed to be. And we are going to hurdle help you over these next couple of months so that we can get you back to being a full-time mom, being a full-time executive director of a nonprofit, a member of your community. We want that for you. And once they started talking about that, that's when the light went on for me. And I said, okay, there is a light at this end of this tunnel. And this is the team that's going to help me get there. Oncology, radiology, their job was done. I had had all the medication. I had had all the radiation. I was waiting on scans, but there was work to be done on symptom management, pain management, emotional support. And that was all offered to me by my team. It's an amazing experience.
Yeah. And that's what I meant by finding out what matters to the patient. Being a mom, being executive director, all those things are just as important to you as your treatment for your head and neck cancer, right?
100%.
And you lose that when you're a patient. You become the head and neck cancer patient. You're no longer the executive director of a nonprofit. You're no longer the mom of, it sounds like you have twins. Mom of, yeah. So, you're not, it's dehumanizing in a way. And we try to bring that back with palliative care. What matters to you? What's important to you? What's your quality of life like? Really bringing the focus back on the individual and not the disease.